Hi, everybody. We are back on Thursday evening with live, another Instagram live from Not Your Mother's Menopause. And we are going to get our guests in. So, welcome April in and give our guest, Assemblywoman Heather Simmons, an invitation. So here she goes.
And while we're waiting for her to join, we just want to make sure everyone's aware that tickets go on sale for our event on October 1st. It's sold out in 5 days. So, hi.
Hi,
Hi,
here
can
we
you hear
are.
me and see me?
Yes, all of
Ooh,
the
I did
above.
it. I'm very proud of myself. And I have crazy hair today. Forgive me.
It's not the best hair day.
It's not a great hair
No,
day.
No.
it's
It's really
not.
not.
And I was just canvassing. I just got home about 20 minutes ago. I was canvassing this evening. So uh,
Thank you.
it's a
Yes,
little bit
awesome.
sweaty and
I
sticky and curly now. So, but that's okay.
You look great. You
You
look
do.
great.
You look great. Everybody looks great on Instagram. I don't know. But
Yeah.
I
Yeah,
want to just,
I need filters in real life.
I wish that these had filters. I am so
So do I.
used to the Zoom filters that when I get on here, I'm like, they don't have the same things. I need the
No.
blurring and the blushing and
Mhm.
I want the slight facelift filter. I'm going to start off. I'm just going to introduce our guest tonight. So I'm not April. I'm Allison, and I'm with my co-founder April.
I
And we are so pleased, really pleased to have Assemblywoman Heather Simmons here with us today. She is serving her first term in the New Jersey General Assembly, where she's focused on making the state more affordable, expanding access to quality healthcare, and strengthening economic opportunities for small businesses and working families. She's championed
Yay.
key affordability measures along with legislation to control electricity rate increases and reduce car insurance costs in very New Jersey. And a leader, and this is what we're going to talk about tonight, a leader, Assemblywoman Simmons is a leader in healthcare policy, and she is spearheading the nation's first comprehensive legislative package on perimenopause and menopause, ensuring insurance coverage and physician education on this critical health issue. So I want to just yay, thank you. I know that this is, I mean, I have no idea what it's like to be in politics, but I imagine it is a um, very, especially these days, a very challenging and exciting time to be doing what you're doing. So,
It is all of those things, and we'll get into this, but it's a little more challenging when you're a woman of a certain age,
well,
right? And
Indeed.
you're going through a change in your body and the way every system, I think it even says on your website, the way every system functions is
Mm-hmm.
changing for us. So
Mm-hmm.
that makes everything more difficult in life.
yes, it is, and it's tough when the world is not used to talking about it, when the world is not used to recognizing it. But there are people out there in the world who are fighting and working to change that status quo on every level. And so I wanted to start, if we could, to start with there's two separate pieces of legislation, and just you have to correct me if I bungle the government terms because it's
It's okay,
not
because
so
I'll
just
do that too. I'll do my share of that as well.
two separate pieces of legislation that you have put forth. So there is the Menopause Insurance Coverage Bill, A 5278, and the Menopause Provider Education Act, which is A 5309. So I wanted to, if we could, I don't know if you want to talk about them, if they're intertwined or how, but when I was making my notes, I was sort of looking at them separately. But do you want to kind of summarize for everybody what these are, and we can go from there?
Yeah, so first of all, April and Allison, I really wanted to thank Not Your Mother's Menopause for reaching out to me and inviting me to participate here and really getting me involved in your mission, which I really feel like is very much aligned with my legislative work. I really like the way you're pulling the concept of menopause and what we're all going through as women out of the dark and into the light, and making real information accessible and understood. Community-based education that's reliable and meaningful and helps us to be understood. And I feel like that aligns so much with the work I'm trying to do in the legislature, where you're absolutely correct. I have two active bills, one focused on physician education, so trying to prevent us from being misdiagnosed, misunderstood, and dismissed. And the other piece is talking about insurance coverage, and it's first of its kind legislation that basically is working to ensure that our quality of care isn't dictated by our wallets. And so there
So
are
appreciated.
two of those bills, and there's a lot going on in legislatures around the country in terms of insurance and treatments, and a little bit on education. But here in New Jersey, this is the first bill in the country that says all insurance carriers in New Jersey, except for Medicare, which is federal, must cover approved menopause and perimenopause treatments and services. Now that means anything for which there are insurance codes, right? So pelvic floor treatments, HRT, and things like that. And there's a very long list of the things that will be covered. So that bill has passed the Assembly, meaning that it's gone through committees and it's gone to a floor vote of the entire Assembly. And I'm really proud because the Insurance Coverage Act was approved unanimously in committee, in all the committees that it went before, and also on the floor of the Assembly, it was approved unanimously and in a bipartisan effort. And what that says to us is that this is not a political issue. Right. This is a quality of life issue. This is a woman's health care issue that impacts, and I think it was recognized by my colleagues, that it impacts half the population, because more than half the population is women, for up to half of our lives.
Yeah.
And so that was a great recognition. So I am hopeful that I will be successful in re-election in November, and then in the lame duck session, I'll be able to push that bill, hopefully, through the Senate and have the governor. I would be very proud to watch the governor sign it.
That would be amazing. I mean, it's so wonderful to hear. And when I was reading this in preparation for our talk, and I was reading about, you mentioned about the kinds of care that are approved. The list was so comprehensive when I was reading through what is in this piece of legislation, where it's not just the hormone replacement, but and like you mentioned, pelvic floor treatment. I mean, our third partner in this, who's not on this call tonight, this is what she does. She is a pelvic floor physical therapist, Stacey Futterman Torriello of 5 Points PT here in New Jersey. And I'm a personal trainer and working with women and, at all stages of life. And pelvic health is something that is not just in this menopausal phase, but in all phases of our life, is something that we as a healthcare in our nation really seem to overlook. But also that you listed behavioral therapy in it, listing mental health in that was like, I read that and I was like, did I just read that? Like, is this in this list? Because that's so huge. Can you talk about how you came up with, like, how this happened, like how this came to be? Do you work with other colleagues to draft this? Like, how did this happen?
I did. Specifically for this bill, I was looking at some of the things that other states were doing, and some of them would look at specific treatments, and I'll just say pelvic floor treatments because that's one that we've been talking about. Some states are looking at specific treatments and saying everybody's got to cover this, or everybody has to cover hormone replacement therapy, or everybody has to cover this drug, right? California's got an active bill that talks about some specific drugs, right, that can be used to treat menopause and perimenopause. But I was thinking a little bit bigger. I said, look, we can pick at this little by little, but I pulled in the nurses and the doctors and the medical schools and some of the nonprofit organizations said, well, help me figure out how we do everything. What does it look like if we say we want all insurance carriers in New Jersey to cover everything? And this was right when I first started my term, and they said, you're freaking out of your mind. Like, we can't do that. Like, that's never going to happen. And so we spent like 9 months, almost a year, saying, well, how do we pick this apart and do it a little bit at a time and have a series of bills that picks at it? And we got to the end of my first summer, and I said, I don't even recognize this concept anymore. I'll tell you what we're going to do. We're going to throw it out and come back to the original concept, which basically says, let's pull all these things that everybody brought to the table. And you're absolutely right. It was professionals in all different areas. Let's pull it all back to the table and say, what are the things that insurance could cover or should cover? And let's create a list. And we also worked with the insurance carriers. And the thing is that every single one of these things on the list is covered in some or most people's policies, right?
You mean already?
My policy, I'm sorry, go ahead.
Currently, like it's already covered currently?
So my policy might cover half of the things, and yours might cover three-quarters of the things.
I see.
You know what I mean? So everything on that list is already coded. So it's possible that insurance can already cover those things. But your policy or mine right now might not.
They don't have to.
Now they'll have to. If that bill passes the Senate and is signed by the governor, all the insurance carriers will have to cover everything on that list.
Amazing.
Right. And we're the first state to do that. And by the way, the insurance carriers testified in favor of this bill and have already submitted a statement to the Senate saying, when this bill is heard before committee, we want you to know that we support it.
Oh, that's
amazing.
Wonderful. That's great.
And I didn't know differently because this is my first time working with them, but apparently they don't do that a lot. So I was
onto something.
I think we were onto something.
Yes, absolutely. And I mean, to be the leader of the trailblazer, really, of these types of coverages that, yes, I agree that some things are covered, just thinking about myself in particular and the things I've already experienced, even outside of perimenopause. But to be able to have that uniformity guaranteed across all of these different insurance companies throughout the state is really amazing. I mean, it's not just a bipartisan decision and agreement. It's like it's not even bipartisan. It's like unilateral insurance agreement, which I think is amazing.
Well, I think that's really what it was. It was a recognition that, look, this isn't about politics. This is about quality of life.
Right.
This is an economic issue because of how much absenteeism our employers have to deal with when, we're incapable of being at work because of physical, emotional, or mental problems. And, so it was really about saying, as I said before, this affects more than half the population for up to half of our lives.
Right. Yeah.
And we have to do something about it. For me, this really came up because I'm sitting in my house right now, right next to my bedroom, laying in bed at 2:00 in the morning in a puddle of sweat, unable to sleep, like so many of us do, and watching those commercials for 87-cent Viagra pop up and saying to myself, can't we do better than this? I mean, I'm laying here, I literally am in a puddle of sweat and I can't sleep. Can't we do better? And like many of us, in the middle of the night, I pull out my laptop and I start looking because I can't sleep. And that's truth, God's honest truth. That's where this came from.
That's awesome. I mean, not the being up in the middle of the night.
Don't I know somebody who could do something about this?
Yes. It's great. And, I think that we're proving you on a much higher level and in a much more public space are proving that we're the ones that really need to keep this moving forward and to make the change like anything else that we've seen, where there's a dramatic change. And forcing people to have conversations and forcing people to think about things differently and to understand what's happening, not just hear about it, but understand what's happening. And it's, not a Band-Aid, and you're really explaining what's happening to women. And like you said, half of the population, and I think the stat is like 6,000 women go into menopause every single day. It's bananas.
Right.
So
right.
you can't escape it either. There's no way
Yeah, like
around
every
it.
single woman or any person with a uterus or an ovaries is going to go through
That's right.
this, and
Right.
those people work and those people contribute to the economy. And, those people have other health care or other health issues that can arise that are going to be expensive to cover when you don't have that preventative care. We were just talking about, actually, April just did a post about this yesterday. Was it yesterday? Yeah, it was yesterday.
Mm-hmm, it was yesterday.
Yesterday
Yeah.
about the efficacy of vaginal estrogen. And,
Mm-hmm.
and this is something that, this is a kind of this is a perfect example, I think, of what we're talking about is like, here is an inexpensive, accessible tool to prevent expensive and debilitating
And
conditions down the road.
potentially
Life
fatal.
threatening, right?
Yeah, yeah,
Yeah.
yeah.
Right.
Yeah.
Right. Well, and that kind of brings us to the second bill. I felt like the concept of providing physician continuing education was critical
Yeah.
because in medical school, only about 30% of all physicians, including OBGYNs, have formal education and training in menopause.
Mm-hmm.
And it's like tiny
And
amount.
it's a tiny amount. So, when we get frustrated with our physicians, on some level, we have to recognize, well, it's not that they're trying to ignore us. They simply don't have training.
Right.
And my first inclination was to say, we must include this in the curriculum in all of New Jersey's medical schools, which sounds easy to do. But in my real life, I worked for a long time at Rowan University, which has two medical schools, an osteopathic medical school and an allopathic medical school. And I know from experience and learning the hard way that you can't tell physicians what to do. And so, particularly as someone new in the legislature, there was absolutely no way that I was going to demand that physicians include in the curriculum for physicians in training something that I wanted, or that
Mm-hmm.
any population wanted. That was going to be not the right way to approach it. And so I brought several of the medical schools, including the two medical schools at Rowan, where I knew people and know people, and said, look, how can we approach this in a way that brings physicians to the table and makes them part of the discussion rather than mandates that they do
Mm-hmm.
something, right? How can
Mm-hmm.
we have this conversation in a more productive way? And they suggested approaching it from the CME side. And
Mm-hmm.
CMEs is continuing medical education. So when you're a practicing physician, every 2 years you have to do 100 credits of CMEs, continuing medical education. And the bill that I put together basically incentivizes physicians and advanced practice nurses to include menopause or perimenopause in their continuing education toward their continued licensure. Now, for physicians, it's CMEs. For the advanced practice nurses, it's CEUs, so continuing
Okay.
education units, and it's a
Mm-hmm.
different number of units that they're required to do either every 2 or 5 years. But again, this was a bipartisan effort, and it was an effort bringing professionals to the table, physicians to the table. This is not my area of expertise, but I'm so very grateful to them for saying, look, if you really want this to be taken seriously, let's take this piece apart just a little bit and figure out a way to introduce it into continuing education curriculum.
Mm-hmm.
And this bill, again, passed the Assembly and passed the Senate and is currently sitting on the governor's desk awaiting signature.
Oh,
So
wow.
this
Terrific.
one likely will be the first bill to be signed
Oh,
into law.
That's great. And that's such a
Yeah.
great solution for what we know is the larger problem, which is that initial education that people who are studying medicine get. And
Yes.
that, from what you said, and I'm sure it's across the board institutionally, getting that curriculum introduced the first time around and not as continuing education. But what a great solution to require this as
Hmm.
part of what they have to do,
Yeah, and we're
because
not requiring it because
oh, it's
not
not
every,
required. I
yeah, not
see.
every physician. So if I'm an ear,
Well,
nose,
that
and
makes
throat
sense, right?
specialist, I may not
Right.
choose this, but to make it available
Available.
and to provide an incentivization, a financial and time incentivization to physicians and advanced practice nurses to pursue it.
Are
Yeah.
there, do you know, like, are there, I have no idea, and you might not even know the depth of this, but are those courses available in menopause and perimenopause? Or they are.
Yes,
Yeah.
yes,
So
for the most part,
there's
they
enough.
are.
Yeah.
Yeah, but you know, it's funny that now that we've introduced this notion as a bill, I'm working with a number of entities, including medical schools in the state, to bulk up what they provide, how they provide it, and to make it available to physicians. So this
That's
has become a
amazing.
conversation. This
Yeah.
has
Mm-hmm.
become an opportunity,
Yeah.
exactly the opportunity I was hoping it would become, where
Mm-hmm.
physicians, physician groups, the nurses and the nurses groups, and the medical schools and the nursing schools are coming to the table and say, hey, you know what? This is really interesting. Let's talk more about this.
No,
Yeah.
You
that's
know,
great.
what
Yeah. I
could
mean,
it look like if we did this? What could it look like if we introduced that? And that is so exciting to me that, you know, now it's something that's being taken very seriously by the medical community, and not just by us who are experiencing it, but by the
Mm-hmm.
medical community who, in a very meaningful and productive way, with proper training, can help us address it.
and
Right.
we,
And become a larger part of the population of people to help all of us who are scrambling to find those providers.
yeah.
Right.
So it's got such a extension to what we are all one of the issues, one of the many that we deal with at this stage of life, right?
Yeah.
Lack of providers
And
to
we,
understand.
in doing what we're doing with Not Your Mother's Menopause and pulling this together, and over the last couple of years that we've been working on this and coming into contact with quite a few OBGYN specifically who have looked at us and, even at our event last year, or this past January, and say, one of the gynecologists who were there in the audience looked at me and was, said, I was a resident for, a gajillion years. And she's like, and I never learned this,
Yeah.
and this was a 1 day community event. Granted, we did have some, and we will again, including
Hmm.
you, because the Assemblywoman will be joining us in January of 2026 for Not Your Mother's Menopause 2.0. Yay. But,
Yay.
other,
Mhm.
with nationally recognized and local doctors who were just, talking about these things that should be part of basic education.
Mhm.
It's part of the, and it's part of the life cycle of the woman. And it is like, we have the babies and then
Right.
And
bye.
yeah.
Right. Well, you know, a friend of mine
Bye.
gave me Mary Claire Haver's book on
Yeah.
Mhm.
menopause. And in it, she talks about her own experience in medical school and in residency. And she said her first experience with menopause education happened in residency because she had as a patient a 42-year-old woman who was complaining about generalized symptoms, an ache, a headache, a weight gain, all these different generalized symptoms. And she went to the physician who was overseeing her, who said, oh, well, you have a WW. And she said, oh, what's that? And he said, oh, that's a whining woman.
Mhm.
Mm.
And apparently that's fairly common in hospitals around the country, that this is some physicians' first introduction to how to treat menopause, which is to roll your eyes and say, oh, it's another woman with generalized symptoms that we don't know how to treat.
That's awful.
Right.
Yeah.
Whining woman.
Mm-hmm.
instead of IG or ID, ignorant doctor.
Well
I'm going to
played.
use that. I like that.
Yeah, yeah,
For
that's very.
physician, you choose IP or ID, whichever.
I like that.
That's very good. So, there's a third thing that I want to bring up, and this is sort of, this is one of the things that we first, in addition to learning about this legislation that you've drafted and put forth, we also got in touch when we first met you over the summer about an event that you did
Mhm.
in your area, which is the third legislative district, which is sort of southwestern Jersey, right, like outside of Philadelphia. Am I
We are
right?
the real South Jersey.
You're real South
Um,
Jersey.
we are Gloucester, Salem, and Cumberland County. So geographically, we are a huge legislative
It's
district.
big. Yeah.
But they go by population, right? So I know in your neck of the woods in Essex County, right? You're in Maplewood,
Yep.
and which is a beautiful area of the state, but it's much more densely populated than it is here. So
Yes, it's very
the
dense.
legislative districts geographically there are slightly smaller than what we have here. But yes, we are the real South Jersey. I live about 25 minutes outside of Philadelphia.
Okay. Right. So you had an event this summer called
Mhm.
Midlife Matters, and it seems that it was a big success. Was it the first one that you did? Can you tell us a little bit about that and how that came about?
Yeah, so a couple of years ago, I started pulling together a group called the South Jersey Women's Alliance, which was an effort to pull women to the table who were interested in becoming more involved in the community, either as school board members or in nonprofits or in their job search or in political office, and say, how can we all work together? How can we be a support system for one another? And as I think you say this on your website too, as we all started to age together,
Yeah.
I realized that as we, sat around the table, and I try to do coffee and breakfast with people as much as possible and catch up with my girls. And it seemed that menopause was the topic of conversation. When it's just women,
Mm-hmm.
we know this. When it's just women at the
Yeah.
table, we're talking
Yeah.
about menopause, and we're
Yeah.
saying, "Oh, I know a guy who can do this," or "I
Yeah.
met a nurse who can do that," and we're swapping stories and um, you know helping each other get through it. And so when I started talking about this legislation, I can't even tell you a constant stream of text messages and social media messages. And I had a woman come up to me in the supermarket who I didn't know a couple of weeks ago, who threw her arms around me and said, "My God, thank you so much for talking
Oh,
about this." And
I
I
Oh,
love
thought,
that.
I think we need to have an in-person larger discussion and find
mm-hmm.
out where people are so that we can begin to meet them where they are and maybe move the ball forward a little bit.
Mm-hmm.
And it seems like that effort is very much aligned with exactly what you're doing.
Yes.
Mm-hmm.
Like it's so similar to
Yes,
what you're
it
doing.
really
And
is.
this
Yeah.
is how I found out about you.
Yeah.
And so we put together through our legislative district. And by the way, my legislative partners are both men. Um,
In
and
writing
my
in writing these pieces of legislation, they're both men.
no,
Oh, in your
my
district.
in my district,
Oh, right. Okay.
Assemblyman Dave Bailey and Senator John Berzicelli. And so they've learned more about menopause than I think most men have, and have been so amazing and supportive and curious and
Right.
genuinely interested
Oh,
in
amazing.
helping this happen. And my legislative aide, who is also a man, and a very young man. He's only 23. So I'm constantly teasing him that he's the only 23-year-old man with a menopause folder on his desktop. But
Probably.
Probably so. Probably
someday
so.
he's going to make
Poor
somebody a
guy.
wonderful husband.
It makes him very progressive. Just tell him he's very progressive.
That's right. And also super curious from the perspective of what women are going through, but also from the policy side of
Yeah.
it. It's
Mm-hmm.
just been a wonderful team. But in any case, our legislative office team, our district offices, put together an event that we called Midlife Matters. And we pulled together some some of the hospital systems in the area, some physicians' practices, some other information resources, and put together kind of a small half-day event where people could gather information. And then as part of that, we put together a panel. And I will, without really trying, we got 100 women in the room.
Oh, that's
And
amazing.
it was incredible. It was in the middle of the day on a weekday. And I was getting constant stream of women saying to me, why are you doing this in the middle of the day? Don't you know we work? Which said to me, my God, we've hit on something here. We have to do this other days of the week, other times of the day, invite more people to the table, provide additional information. Mm-hmm. And then through this process, I learned about the work that you were doing. And, you know, there are a couple of other organizations out there, and it really struck me like we all need to come together and make this bigger, because we're kind of all saying the same thing. We're being misunderstood. We're being misdiagnosed. We're being dismissed. And by the way, when we finally get some kind of a treatment, my insurance doesn't cover it. Now what do I do? I'm not going to do the treatment because I'm taking care of my parents, I'm taking care of my kids, I'm taking care of my house. I'll put myself last. I'll take care of these other things.
Yeah.
Well, we can do better than that for ourselves.
Absolutely. Yeah. And it's not even, I mean, that's half of the battle. And then the other half of it is really getting to the point where we can hand over the information for women to take and know how to have those conversations. That's a really big piece of what we're doing. It's educating on what it is, why, how. You're not alone. But then it's like, okay, but now that you know this, taking this information and becoming active. So it's great that it's happening in all these different parts of the state or of the country. I actually am a board member of Let's Talk Menopause, and I know that you had Marie Capozzi as part of your panel. And
that was incredible.
I'm so sad I missed it. It just, unfortunately, was a work day. So I had to work. But, you know, I think...
You very wisely have your event in January on a Sunday. And I thought,
although we still have weather.
These women know what they're doing.
No weather.
No weather.
Well, you know, especially, I will tell you, I don't know if you know this about me, but I know Maplewood and your part of the world very, very well. And the reason is that I am a patient at Cooperman Barnabas Medical Center.
Oh, that is in our backyard.
Yeah. Right in your backyard. I received a kidney transplant there.
Wow.
In December of 2019 on an extremely icy, snowy day when my brother, who was my donor, left his house a few minutes outside of Philadelphia at 3 o'clock in the morning with his wife and drove himself to the hospital because she was afraid to drive in the snow.
Oh my gosh.
So that we could check into the hospital. And so I know how snowy and icy it gets in your neck of the woods.
Yes. Oh, wow. What a story. I mean, I'm so glad you're doing better, and what a hero your brother is for giving the gift of life. That's amazing.
That is amazing.
He did, yeah. You know, this is a little bit off the subject, but I promise I'll bring it back around. I was diagnosed with diabetic kidney failure in my mid-20s and was told that I would need a kidney transplant in 10 years. And it was 24 years later when I had my transplant. And the reason for that is that I had access to the best medical care, the best physicians, the emotional support of my family and loved ones. And I've educated myself about that because I'm in a position to do that. And, you know, then you get to this stage of life and it's different. It's a very different situation, but it's the same kind of questions, right? Why am I sweating all the time? Why is my hair falling out? Why do I have these pains? Why, you know, why? And you're trying to put together a picture of a very complicated thing that's happening to you that your physicians don't seem to be able to help you with for the most part. And I thought, well, I guess I'll approach this in the same way. I'll educate myself. And
Mm-hmm.
it was harder. It was much more difficult because the information wasn't out there.
Yeah.
And, I really launched into becoming a legislator. I had been a county commissioner for about a dozen years before this in Gloucester County, Southern New Jersey. And I decided to run for higher office because I really felt like the fear, the confusion, and the time and the questions that go into a chronic illness, a catastrophic illness like kidney failure, um, leaves you very much alone in a lot of ways,
Mm-hmm. Mm-hmm.
and feeling like things aren't accessible to you. And I thought, I can help other people who didn't have the same outcomes as I have. If I could even help one person, that would be worth it. And then, right in the beginning of my first term, again at 2 o'clock in the morning, watching these commercials, kind of the same thing struck me. I thought, well, you know what? Maybe I can, have a little bit of an impact in this area of healthcare as well.
Mm-hmm. I think that we're all cut from the same cloth in that way, because
Yeah.
we're experiencing something that we didn't quite understand, and very odd things happening, and like no explanation, feeling alone. And then like, well, what do I do about this? What
Yeah.
can I do about this? And once we learn that information, it's like, well, how can I share this with others?
Yeah.
Like, we all
Right.
need to know this. And this is
Yeah.
really hard to get. So very much very similar motivations, which that's what we need. We need
Yeah.
people like us, and for you to take it that one step further in a public forum and with the government to push this stuff along because you're curious, because you want to help other people, because you think this information deserves to be discussed and legislated. And it's really incredible that we have representatives like you, in this
Yeah.
case, you, to really, as I said earlier, be the trailblazer for
Yeah.
something that is an unpopular discussion, because it's about aging women and about healthcare and things that are private and people shouldn't
Mm-hmm.
be talking about because they feel uncomfortable.
Right.
And just and two, it also brings up what you've done on your local level, not only with the legislation but with the event that you held this summer, and what we are
Mm-hmm.
trying to do here is really it shows the importance and the value of of the fact that we can make change, of that grassroots um,
Yeah.
community organizing effort, like that actually does work. Because we do this thing and we're three middle-aged women from Maplewood, from Essex County, and we want to do this thing. And then all of a sudden, there's really big name people coming and big sponsors coming,
Mm-hmm.
and the people who we live next door to are coming to hear these people speak, and then they're armed, like our sisters, our neighbors, our friends are armed with the
Yes.
information that they need, and then it goes out into person to person to person. And so it really is like it's it's amazing, and you're doing the same thing,
Yeah.
but you can actually do it on both levels. Like you can do it, you can have the event for your local, for your constituents and with your local providers, and you can, like April said, blaze this trail for women in New Jersey and hopefully nationwide. And I'm assuming that other states are watching what you're doing, and
And we're
hopefully.
watching what they're doing as well, because there are a lot of legislators in other states who are saying, you know what, this deserves to be in the limelight. This deserves to
Mm-hmm.
have attention brought to it.
Sure.
Really,
Absolutely.
mostly because of organizations like yours. Like you grew this from three women in Maplewood to 1,600 people just on your social media. I don't know how many people are in your whole organization, but now you've got something, right?
Yeah.
Now
Very
you've got
Yeah. Yeah. So
real
true.
real support.
It's so
kind of
true.
amazing. It's
Yeah.
like, and it's the moment, there was this swelling of the conversation that happened, and now I think we're at a very crucial moment in the discussion where there can actually be real, like tangible it's not just let's talk about menopause because this is not something you need to be ashamed of, and women's health and aging and stuff, these are, this is normal, but also now things are actually happening that can change the way we live our life, not just how we talk about living our lives.
Yes.
Your policy is going to be able, people who, women like me who were like, I'm an anxious person, but all of a sudden I want to jump off a building and that's not normal, and then I think, I can't, my insurance doesn't cover mental health, so now what you're I'm that person. I'm the person who has marketplace insurance from Get Covered New Jersey, and it does not cover mental health,
Right.
and I'm also the person who's lucky enough that I can swing it for myself,
Right.
but there are so many people who are
Mhm.
suffering who aren't going to be able to get the full package. My insurance covers this, but not this,
Right.
so
Right.
being able to have to know and just get that burden of how am I going to pay this much money for the thing that's going to keep me sane, how am I
Right.
going to, yeah,
I
it's
mean, that
amazing.
goes to the
Yeah.
equity piece of all of
The
this
equity.
too, just really creating equity for, under-resourced populations and the marginalized, and this levels the playing field, which is exactly what's supposed to happen. Healthcare should be a level playing field for everybody. So it's that next level that's even more incredible about this,
Mhm.
is giving everyone the same chance to get the help that they need. Unfortunately, not in all walks of life across all of their, maladies and whatever in all stages, but as you said, this could be half our lives.
Right.
So
Yeah,
having that equity built in to these pieces of legislation is a huge gold star on top of all of that.
it's amazing.
Well, simply put, our quality of care shouldn't be determined by our zip code or the size of our wallets or by our gender.
Agreed.
Very
So
Thank you.
true.
that's what we're doing.
Very true.
Well,
Wow.
it's just amazing. I mean, this blew me away having this conversation with you, really hearing about all the work that you've been doing. I mean, now, we've been following you and keeping tabs on you. Sounds weird, but we have been since we met. And we're so excited that you'll join us on January 11th. We'll talk in greater depth about the political state of women's healthcare and what's being done to help us be paid better attention to. So we're really looking forward to having you up here in January.
I'm looking
Um,
forward to it as well because I will be leaning on you and keeping tabs on you as well to figure out how I can take this discussion in the southern part of the state to the
Mm-hmm.
next level and use the example that you guys have carved out to say, okay, we had a really good introductory level midlife matters event for 100 women. What's next?
Mm-hmm. Mm-hmm.
We obviously aren't going to do the same event again. It
yeah,
has to be something that ups the ante, takes it to the next level, and really puts people in a position to say, I was curious about this. Now I'm empowered about this. And now
Mm-hmm.
maybe I can work to affect some change.
well,
That is exactly the lens we're viewing this. We're calling it Not Your Mother's Menopause 2.0. So
yeah,
happy to collaborate and talk
yeah,
through it. We would love to have discussions about that and executing something bigger
yeah,
for you in the South, helping out with that. So
yeah.
Well,
I
we'll
mean,
do it
definitely.
together, and we're all being recorded saying this, so now we're all stuck together, and we'll
We are.
yes,
So,
indeed.
we'll be working together on it.
Yes.
yes. So the website to visit to learn more about what the Assemblywoman has put together and all the work that she's doing is ld3, the number 3, nj.com. And we'll put that in the recording when we repost it in a few days. And this recording will also live on our YouTube page, which is linked in the bio of this Instagram of the Not Your Mother's Menopause Instagram account. So all of this information, this talk, and the resources will be included there in the next couple of days when we get it up there for everybody. And yeah, I thank you. We thank you
Yes. Thank
so
you
very
so
much for
much.
joining us on this Thursday night.
Well,
And thank you for all of the work and
April,
advocacy.
Allison and April, thank you to both of you and to Stacy for the great work that you're doing and for the opportunity to have this discussion, and for the continuing opportunity for us to make a difference for so many others like us.
We're
Thank
happy
you
to
so
be
much.
part of it all. Thank you so much.
Take care. Thank you.
Thank
You
you.
too. Bye-bye.
Bye.
Bye.